Hello everyone, this is Dr. Anupama. I'm a hair transplant surgeon and a skin specialist at Derma1 Clinic. Today in this video, I'm going to discuss about the best hair loss treatment for men and women. I get a lot of queries regarding the solution and cure of hair loss from both men and women. So today in this video, I decided to discuss all the hair loss treatment options available with you. By the end of this video, you will have a lot of clarity regarding the different hair loss treatment options and you will be able to decide pretty quickly which treatment to go for if you have hair loss. So before discussing the different treatment options, let us first discuss the common causes of hair loss in men and women. So in males, the most common type of hair loss is male pattern hair loss or androgenetic alopecia. It happens because of the action of a hormone called as dihydrotestosterone on your hair follicles. This hormone is made in your body from testosterone hormone by the action of enzyme 5-alpha reductase. So this DHT or dihydrotestosterone acts on your hair follicle. It makes your hair strands thinner, shorter and lighter in color. So if you have this type of hair loss, you will see that your hairline is receding over a period of time, and also over a period of time you will see thinning and baldness happening in this area of your scalp. Now coming to the reasons of hair loss in females. Most common type of hair loss in female is acute telogen effluvium. It happens because of some sort of medical or surgical illness. So after 3 to 4 months of this type of illness, you will start experiencing a lot of hair loss. So there will be an overall decline in the density of the hair. We generally do not like to touch this type of hair fall because over a period of time, this improves on its own. Female patients can also experience permanent thinning or permanent type of hair loss. The most common causes of permanent thinning are chronic telogen effluvium and female pattern hair loss. In female pattern hair loss, thinning is mostly seen in this region, whereas in chronic telogen effluvium, thinning happens all over the scalp. There are a lot of causes of hair loss in females. Most important causes are nutritional deficiency, including iron deficiency, abnormalities of thyroid hormones, and hormonal imbalance. For example, increase in the male hormone in a female body can be other important causes. Other than this, stress and smoking are also important for hair loss in females. Now, these are the most common causes of hair loss in men and women. So in this video, we will focus mainly on these common causes of hair loss in males and females. Now let us discuss the different treatment options that are available. So these treatment options can be medical therapies in the form of minoxidil and finasteride, PRP, hair transplant surgery, and camouflaging techniques which include hair patches and wigs and hair fibers. So the first treatment option is minoxidil. Minoxidil is usually available in the lotion form. It is given in different concentrations to males and females having hair loss. It acts by increasing the blood flow to the hair follicle. So by increasing the blood flow, it increases the thickness as well as length of individual hair strands. If you apply minoxidil twice daily, you will see that your hair loss will reduce in 3 to 4 months, but the hair density will increase over a period of only 6 to 12 months. It generally does not have any major side effects, but minor side effects like irritation on the scalp, dandruff on the scalp, and headaches, which are infrequent, can happen. So these side effects, they usually improve with the continuous use of minoxidil. It is a very important medicine. It is the first line of therapy that we usually prescribe to our hair loss patients. We have a separate video on minoxidil on our YouTube channel. If you want to know more details about minoxidil, you can go through that video. Now let's discuss about the second treatment option. So second treatment option is finasteride. It is available both in the tablet and lotion form. Lotion form is usually available in combination with minoxidil and it is applied again twice daily on the scalp on the affected area. Finasteride acts by inhibiting the enzyme 5-alpha reductase. By inhibiting this enzyme, it reduces the concentration of dihydrotestosterone in your scalp, thereby promoting the thickness and length of your hair follicles. Now, finasteride also takes around 3 to 6 months to reduce your hair fall and 6 to 12 months to increase the hair density. Coming to the side effects of finasteride, finasteride per se does not have any major side effects in the doses that we give for hair loss treatment, but few patients rarely can develop sexual side effects. Your doctor will discuss these sexual side effects with you before giving this drug to you. So now the third treatment option for hair loss is PRP or platelet-rich plasma therapy. Nowadays, it is very commonly used. In this method, we withdraw some amount of your blood and then we process your blood in a machine. By processing it, we are able to separate growth factors from your blood cells. These growth factors are then injected onto your scalp close to the hair roots so that hair roots are able to get growth factors in higher amounts than usual. By doing this, the density also increased due to increase in the thickness and length of your hair. I generally recommend 3 to 6 sessions of PRP to my patients done at an interval of 1 month. After doing the PRP sessions, you will see that your hair fall will reduce in about 2 to 3 months. The density increase you will see after about 6 to 7 months. That means it is a very quick acting procedure. Coming to the side effects of PRP, it does not have any major side effects, but after the procedure, you may experience little bit of headache or heaviness in the head. You may also see little bumps on your scalp that will go in about 1 to 2 hours after the procedure. Rarely, it can lead to infections on the scalp. PRP is usually prescribed to you along with minoxidil, as by itself it does not have that much effect on your hair. Also, it can be given to you if you're getting the hair transplant done, as it speeds up the result of hair transplant. Now, the fourth treatment option for hair loss is hair transplant. Hair transplant is a surgery wherein we extract follicles from this part of your scalp because they are resistant to DHT, and then implant these follicles onto this part of the scalp. Beard hair and body hair can also be used for the transplants. Hair transplants are usually recommended in males who have developed baldness in this zone, and also it is recommended in females who have developed quite a lot of thinning in the same zone. After doing hair transplant, you'll see little amount of growth after about 3 months of the procedure. Then this growth will slowly increase, and by about 6 months, you'll see 80% of your result. Final result will come after 9 to 12 months. It is usually combined with PRP procedure. Hair transplant by and large is a very safe procedure. Common side effects include pain in the recipient as well as the donor area, which are usually taken care of by the normal painkillers, and pain usually subsides by 2 to 3 days. Now, you can also develop numbness in the recipient area that also subsides on its own over a period of time. There can be other uncommon side effects also, but they are very rare. Now, we have made a separate video on hair transplant. You can go through all those videos on our YouTube channel. Now, let us discuss about the camouflaging technique. First camouflaging technique is by using hair wigs and hair patches. If you have any contraindication to hair transplant surgery, or if you don't have a good donor area, then you may opt for hair wigs and patches. If you're using a very good quality wig or a patch, then you may achieve very good results. But yes, they do require maintenance every month, and they may also require replacement after every few years. Now let's discuss about the hair fibers. Basically, hair fiber is a brown or black looking powder which can be made of either human hair or synthetic material. It is just sprinkled onto your scalp, and it can give you an illusion of a dense looking appearance or dense looking hair. Hair fiber is usually prescribed to those who have thin hair and are not responding to medical therapy or hair transplant. These fibers basically stick to your existing hair by electrostatic forces and gives you an appearance of fuller hair. Now, these were the top 5 hair loss treatment options for men and women. There are other treatment options also, but I'm going to stick to those which have scientific evidence available. So these options are dutasteride. Dutasteride is basically similar to finasteride in the mechanism of action, but it is more potent compared to finasteride. That is why it has more side effects also. Then bimatoprost. Bimatoprost acts by increasing the blood flow to your hair follicle. It can be given along with minoxidil or other medical therapies for hair loss in those who are not responding to just one medical therapy. Then there is another therapy called as low-level laser light therapy. It is also given in combination with minoxidil, those who are not responding to just the effect of minoxidil. Another option for the hair loss treatment can be derma roller therapy. It is combined with minoxidil in patients who are not getting good results. It may not be effective in every patient and results may not be very good, but it is an option and you can combine it if you're not getting very good results with just minoxidil and finasteride. Derma roller therapy can also have side effects like infection if not done properly, so always get it done under the supervision of a doctor. Now, this was all about the different types of treatment options available for hair loss in men and women. If you want to know details about any of the mentioned treatment option, you can comment in the comment section below. We will try to answer all your queries.